So Chiranjiv Singh is the Chief Commercial Officer at Qure AI, a healthcare startup that's developing AI algorithms for medical imaging. Their products are built using deep learning technologies and millions of images, helping detect anomalies in CT scans and X-rays. The startup has particularly been hailed for its technology solutions QXR and QScout during the COVID-19 crisis for accurately and speedily detecting abnormalities in chest X-rays and reducing the downtime for radiologists and healthcare staff around the world. The tech has been used in India, Italy, Mexico, Oman, and many other nations to screen COVID patients and is garnering praise for its quick turnaround time, specificity, and conclusiveness in detecting ailments. And in this way, paving the way for tech driven healthcare, especially in limited or low resource settings. Chiranjiv is no newcomer to the field of health tech. Prior to joining Qure AI, he spent 13 years at GE Healthcare, where he was instrumental in launching the first ever X-ray device with an embedded AI algorithm. He now joins us from Wisconsin, US. Thank you so much for joining us, Chiranjiv. It's a pleasure to be here, to be joining you on this call, and welcome to INDIAai.
Thank you, Sunduja. It's a pleasure to be talking to you and looking forward to the conversation.
Absolutely. So it's a crazy time, whether you're in the US or whether you're in India. I think this is something that's united all of our experiences, I think, for the first time in mankind and collective humanity at this point in time, right? So,
Right.
you're a part of Qure AI, you're the Chief Commercial Officer. How have the past 6 months really been for you?
So it's, as you rightly said, and I completely agree. This has been a time where I think it's perhaps the first time in our lifetime that anyone I speak to around the world is going through the same experience. It doesn't matter whether you're in India, Australia, Brazil, US, any part of the world. Everybody is in lockdown. Everybody is figuring out how their government and their country is gonna, stem this spread of the virus, and it's been a unifying experience in that sense. For us at Qure, we've actually been super active. It's perhaps been the busiest 6 months since I've joined Qure, and that speed of pace, the speed of adoption has impacted us in many ways. It's been interesting because obviously our core team is in Mumbai, and Mumbai is, the hotspot or the biggest hot zone for COVID. Everything is under lockdown. So imagine all the team sitting remote. I mean, I've seen photographs of the entire wall of one Mumbai apartment being converted into almost like a board with post-it notes and everything happening virtually. Our sales team, which I lead, we've actually been working almost 24/7. I mean, I don't think ever in my career have I done sales calls at 3 a.m. or 2 a.m. because we've been reaching out to customers around the world, in every possible time zone, spreading the word about our products and how we can help them tackle this pandemic that they are facing. Our install base is more than doubled. So that's been an amazing experience for our deployment teams. And in a way, we are lucky. It's all software, so it's something that can be remotely deployed. But it's been a completely new experience in terms of iterating our solutions for COVID, in terms of presenting them to customers, in terms of actually closing orders, getting deployments, and seeing the product impact patients. I love what you said. I think in our introduction before the call started, that eventually, AI is important not just for a technology, but for the impact it can create on our lives. And we are seeing that impact come true in the last 6 months.
Yeah, absolutely. I think this is a very definitive moment in mankind and definitely an inflection point for technologies, especially like AI, and all of these days we've had conversations about it. There's been work happening in pockets. But I think now for the first time, we're really seeing everything really come together beautifully. So I just hope that, this is just the beginning of something new, especially for technologies like AI. So, tell us about the product journey of QXR and QScout. It has varied AI and DL capabilities. And can you tell us a bit about its accuracy and the level of results that it's been producing so far?
Sure. So they're two distinct products. I'll start with QXR, which was one of our first products that we launched. It's a deep learning algorithm that can interpret chest X-ray images. Our first version of the product was launched 3 years ago. and we've been evolving and improving the product along this time frame as we've been getting more data, as if we've been working with customers around the world, getting their feedback. The product, in a sense, has the capability to read a chest X-ray and detect, at the current standpoint, about 29 distinct findings. So it can tell you whether it sees a nodule, whether it sees a rib fracture, whether there is a feeding tube that's been misplaced. So different clinical applications, and at one level, it's also found a lot of adoption just as a workflow management tool.
Okay.
X-ray, as you may know, is the most commonly done imaging exam around the world. Even in the
Yeah.
United States, or be it in India, the first screening exam in imaging that happens is a chest X-ray. And because of the high volumes, everywhere in the world, there is a shortage of radiologists to read chest X-rays. They're already
Yeah.
overburdened. And we realized that a lot of hospitals we went to said, listen, I'm doing 200 X-rays a day. Can you tell me which are the 20 that are important? Which are the ones I should read first so that I don't, delay patient care? And we started doing that with customers. Some of our early success with the product in India and also outside of India came from partners who were doing tuberculosis screening. As you're aware, tuberculosis is still a very big burden disease for India and other emerging markets.
Yeah.
And we found a very good solution to the potential delay in diagnosing TB. It's a disease which is more than 100 years old. Cure is known. The medication is available. But the challenge always was, how do you detect it early enough? And we figured out that the workflow for that tool was inefficient, in the sense that people would take an X-ray, then wait for maybe a week for that X-ray to be read. And in that week, if the person X-rayed was diagnosed with TB, that person is still walking around the streets spreading the disease. It's an infectious disease like COVID. That time period of a week to diagnose, we cut it short to a few minutes, because we enabled our partners in India, in other countries. I mean, India, we have done a lot of deployments for TB, where the moment the person does the X-ray, even before they've left the room, we can give an alert saying whether we suspect TB or not, and you can immediately mask that patient, take a swab sample for confirmation. So that was one of our early success, and it continues to be a big part of how we've grown QXR. Obviously, other deployments have come.
Right.
Now, when COVID happened, we realized that we have data and we have the expertise to also detect findings in the X-ray that are indicative of COVID. We can see an opacity, and we can see whether that opacity is indicative of COVID or is it something else. So we repurposed that tool and very quickly started giving it to our customers. Initially, our customers who were doing TB screening, to get their feedback. Once we reached borders outside of India, when we reached countries like Italy, which was one of the early countries to get impacted by high number of COVID cases, we realized that there is more value we can add by not just helping them detect or diagnose, but also helping them monitor the progression of patients who have COVID. As you would know, and I think everybody is aware, that there is no known cure for COVID, right? There are a lot of drug trials going on, but no approved drug so far. So a very critical task for hospitals is, how do you manage the flow of patients? How do you decide whether the person who's been tested positive, should you admit him or should you let him go home? Once you've admitted a patient, how do you decide what is the right time to move them to an ICU? What is the right time to put on a ventilator? And a daily bedside chest X-ray that an algorithm like ours can measure and quantify is proving to be a very valuable tool in that clinical decision making. So it's been a very interesting journey where we've used QXR not just as a workflow or as a detection tool, but we've also helped our clinical partners in actual decision making and progression for patients while they are admitted for this disease. Q Scout was actually a new product. We did not have something called Q Scout before COVID.
Okay.
And when COVID started and we were talking about how the cases are rising, this is very early days. This is almost end of Feb. that as a team we were thinking, and we were saying, listen, if this continues to grow, our current hospital infrastructure around the world will prove to be insufficient. There are
Right.
not enough beds, there are not enough emergency rooms, or not enough testing facilities to take care of everyone.
Yeah, that's true.
So
That's
we
true.
said, why not build something which can help institutions and countries manage their populations remotely? We know a lot of people have mild symptoms, and since there is
Mm.
no known treatment, perhaps all that they need is an isolation and a continuous monitoring. Now, why not do that remotely through a mobile technology, through a chatbot, and using some AI,
Mm.
and prevent everybody from rushing to the hospital?
Makes
It's
sense.
interesting that
Mm.
the genesis of this product lay in some of the work we had done for tuberculosis. Because even in TB, we had this concept of contact tracing. The moment you detect somebody for TB, you want
Mm.
to go and test everybody else in their household or their workplace to check if they also are carrying the disease
Yeah.
or the virus. And we translated some of those learnings and some of the tools we built for our TB partners to
Mm.
build this completely new tool called Q Scout. And it was amazing, and that's the benefit of a startup like Qure, where from our first discussions of, listen, we can build this as a concept, to our first sale was less than 30 days.
Less than 30 days. That's impressive. That's an
So it
impressive
was
turnaround time. Yeah.
amazing at the pace. I mean, I know that our engineering team was like working, almost 18, 20 hours a day sometimes,
Mm.
writing code, testing it, because we knew we don't want to release something which doesn't work.
Yeah, definitely.
And we've had great success. You asked me about the accuracy. So for QXR, we have enough research and validation where on every finding that we do, we have an accuracy number of high 90s. It depends and
Mm.
varies on each finding. For Q Scout, it's not as much an accuracy number. I think we're measuring it in terms of adoption. And,
Of course.
Oman that you mentioned,
Mm.
we've been scaling up. We started with some few thousand patients being monitored who are under quarantine. And
Mm.
we are now, at a stage where we're potentially talking about the entire country of Oman using it as a safe way to come back to work.
Right.
Because obviously
Yeah.
every country wants to open up the economy, and they want to know how can they safely determine who is ready to come back to the, shop floor in a factory or a bank or whatever environment they're working in.
Yeah. Makes sense. I think, just the fact that you've been able to give a very comprehensive solution, because one thing is, of course, to maintain that workflow and understand what's happening at the hospital level and really start isolating patients on the basis of criticality. And the rest, of course, is the whole argument about contact tracing and how that can be done in an effective manner. And if they're both given together, it definitely helps hospitals and generally healthcare workers to track and trace and manage all the patients in a very effective manner. So there is a very clear workflow there. I think that's very interesting. So of course, your solution is now being used in various countries. I'm sure. I mean, that must have been a journey in itself. I mean, you've pretty much spanned the globe in terms of where you've taken your product, which is phenomenal. But how was it really like to get these hospitals to adopt your tech? And at a time like this when demos are a challenge, how were you able to really convince these people to use your technology, at a time like this?
Yeah, no, a great point. And, I'm kind of laughing because honestly, there was a joke I read a few months ago that if history would record, and ask who was responsible for the digital transformation of healthcare, the correct
Hmm.
answer should be COVID-19.
Yeah,
So COVID has
actually.
actually made our job of convincing hospitals to adopt our tech easier in many ways.
Mm.
There is a realization that, listen, not every physician can come to office to work.
Mm.
There is a realization that, as I said earlier, maybe not every patient needs to come to the hospital. You are also concerned about not just the workflow for healthcare workers, but their safety as well.
Absolutely.
And a lot of the barriers to adoption of technology, how will we integrate IT? What is, the security behind it?
Mm.
We have seen a more openness from our customers around the world when we have proposed solutions. I'll give you an
Mm.
example. So most hospital IT departments historically had a view that, listen, we want to protect all data within our premises. We don't want to release it to the cloud. We've been able to get more cloud adoption during COVID because people realize that, listen, we anyway can't have engineers coming into the hospital to deploy servers. So that's been one example. In terms of demos, in terms of our selling process, it's all been virtual. I mean, we've become natives on, Skype and Zoom and you name it. I think I have 9 such platforms on my phone and on my laptop where all the demos have become virtual, all our presentations, all our trials have become virtual. We've signed contracts digitally, and all the deployment has been virtual. So we've, hand in glove with the customers, with their IT departments. Even a few cases, like I know there were hospitals or trusts in the UK where the NHS was still not allowing them to move data to the cloud or outside the country. We've still been able to deploy within their data center, all remotely being done by our engineers sitting in Mumbai, which we would have never imagined pre-COVID times. We would have flown someone to UK to do that deployment.
Precisely. Yeah.
So it's been a great experience, and I would say it's we've used technology as it should be. We've seen an openness from our customers. We've seen awareness and a realization that, listen, people anyway can't travel, so let's make things work. And people have been more open to what we've suggested as alternate ways of adoption or demo or deployment, and things have just worked.
Yeah, I mean this entire phase I think is very reflective of the fact that when you don't have another option, you just have to move forward. There is no looking back, and and every company I think goes through that one very definitive moment in their career curve where which is like a make or break moment for them. And I think this particular time has proven to be that make or break moment for you. And Qure AI really is a fantastic example of an Indian product company going global. And I think your success during the COVID time has just completely consolidated this idea of phenomenal success. So what do you think is the mantra to this, and what are the cues that other product companies can really take from Qure AI?
Great question. And you're right. While we've had a lot of success of Indian software companies, we all know, the great work that companies like Infosys or TCS or Wipro or so many others have done in the software space. But you're right, there are very few product companies and very few software product companies that have gone global. I think some of the things that we've done and we continue to do is starting with focus. It's very easy when you're a small company to go to a customer and the customer says, hey, listen, but I don't want X, I want Y. And the attraction for a small company is, yes, let's build Y as well. But what many people don't realize that to build a good product, you need depth, you need to refine that product to a level where you can deliver on your customer promise. And that takes time. That takes a lot of investment. That takes a lot of understanding of how it's being used, what is the feedback. And to a large extent at Qure, we've kept a narrow or a focus on solving few problems, understanding them well and solving them in depth. Right. I don't think too many product companies do that. I think a lot of product companies, especially when they are small, it's a different scenario when you are a large corporation with many years of experience. But when you're small, I think it's very important for product companies to understand their customers, understand their workflows, and go deep in a few areas rather than trying to solve every problem. Because if you try and solve everything, you end up just touching the surface and not solving it well enough.
Yeah.
So that's I would say the first thing I would start with. Maybe the other mantra for success, at least for us while it's a product, it's still a software and a subscription-based product, is focus on adoption. Technology in itself, irrespective of how good it is, irrespective of how accurate my AI is, until I understand my customer workflow, until I understand how it's being used and kind of handhold them for the usage, I will not grow. I mean, I often try and give people an analogy of Netflix as a streaming service, right? If I'm
Mm.
not happy with the content of Netflix, I can very next month shut off my subscription.
Yeah, true.
It's not like the old days, and it's not a hardware product where once I bought a car, even if I don't like the car, I'm stuck with it for at least 6 7 whatever years I'm using it.
Right.
All our products are subscription based softwares, which means unless we spend a lot of time in getting the right customer adoption,
Mm.
unless we make sure it's integrated into their day to day usage, we will never get a happy customer who leads to the next one. So I
Yeah.
think those are the two very key mantras, and I'm sure there are more that I can think of. But at the top of my mind, it's getting a focus on your product, going deep in a few areas, and two, making sure it's getting adopted the right way, taking care of your initial customers.
Absolutely. No, these are two very broad, focus areas which I think any startup in the deep tech space should be focusing on at this point in time. Because if we're able to establish their expertise and that subject matter, understanding in one particular area, and we're really able to go deep, I think that is going to be the definitive point, which sets us apart from everybody else. And
And
you've really shown how to do that. So I think that's very encouraging for other startups in this space
maybe
to really
maybe
watch
I'll
and learn from.
maybe just another thoughts in the jar. I'll add another
Yeah,
point. So
sure.
we also knew for a fact that while India has a very good name for its engineers and its even in the healthcare field, clinical talent,
Mm-hmm.
there has been very few, if any, Indian AI companies in healthcare, and we had to build credibility, which is not less than any US or Israeli or any other company from coming from any part of the world.
Yeah,
So a
I
lot of
agree.
the validation and a lot of the research we did early on, while we started in India and a lot of our partners were Indian
Mm.
hospitals, very early in our growth, we started reaching out to the top academic hospitals in the US. So we were able to get research and publications with the top academic institutions and the top publications in US and UK and all the Western markets,
Mm.
which then gave us a credibility in the eyes of the clinician or the healthcare institutions, which was not less than any company coming out of San Francisco or the Bay Area.
Yeah, true.
So that was again a very critical part, and I've seen that play a very different role. I've been in conversations where the first reaction when I meet someone and I tell them I'm from an Indian company, I can
Mm.
see that look in their eye. But the moment I tell them that, listen, we've done this kind of validation and research with the top US institutions, or we've got publications in the Lancet and Nature,
Mm.
they look at you differently. So building that credibility at the right global forum is another
Mm.
thing that's been very key to our success as a product company.
Definitely. Yeah, absolutely. I think you're absolutely right. And I think the credibility is so important because it's healthcare as well. It's about people's lives. It's about their welfare, their well-being. So, you're constantly being judged on that metric. So it's understandable where you come from. And coming back to, of course, COVID and the whole healthcare situation that we're in, where do you really think we're at in this particular pandemic? It's been, what, 6 months now, I think, since India, at least, really essentially sort of shut down. And now slowly we're opening up in pockets, but the threat is definitely far away from, we're definitely far away from saying that the threat is past us. So how do you think AI is really going to effectively help us flatten this curve, if at all?
Sure. So, where are we on the curve? I don't know. I wish I had a crystal ball. I hope and pray we are at the peak or beyond the peak. But every time I think that the next few weeks, I still see a increase in
Yeah.
cases around the world.
Yeah.
Unfortunately, uh, the way I look at AI and the way I look at our role is, it's I I I I I actually draw inference from what happens with the seasonal flu in the US.
Okay.
There is a
Okay.
vaccine for seasonal flu, but that vaccine changes every year because the
Yeah.
strain of the virus
Strict.
changes every year.
Yep.
I've also had situations, even in my own family, where, one year when we took the vaccine, 2 months later, my wife still had the flu
Okay.
because the virus, I think, is in a way smarter or a few steps ahead of what the vaccine is doing. I
Right.
somehow see that similar thing playing again in COVID. While, yes, there are,
Mm.
I don't know, 300 plus drug trials and everybody is waiting for the vaccine. I, looking at that in analogy and looking at my experience, don't think the vaccine will be a silver bullet. And every country, India or anywhere in the world, will need to look at how do we manage our population and how do we get back people working, and how do we get the economy back running in the presence of the virus. Yes, there will be vaccines, but we still don't know how effective those vaccines will be. Will the effect of the vaccine last 3 months, 2 months, 6 months, or a year? We don't know yet.
Yeah.
So I think some of the basics in terms of, monitoring people remotely, maintaining social distancing, uh, doing as early a diagnosis as possible, and getting treatment to the right people at the right time will will become, and already are, and will remain very critical elements of how every country flattens this curve. And in all those things that I mentioned, I see AI playing a role. It's humanly impossible for even contact tracing, as it's being rolled out in many countries, to be done physically. You cannot go
Yeah.
into the streets of Mumbai or Delhi or any other city and go into every household, knock doors, and check their symptoms. You may do it once, you can't do it 3 times a day.
Yeah. True.
Technology like AI and all the other technologies available today can do that. You can actually get into a whole longitudinal record of a patient. You know, the next time that patient comes with a cough, you know, using AI, looking into their past health records, whether there was an incidence, whether there is a likelihood of their immunity having developed, and therefore your protocol and your testing may be different. So I think there is a big role, and fortunately for us, hospitals or healthcare systems around the world are realizing that you need to be smarter about how it's a 21st century virus. You need more technology and more tools to help you battle this. So that's where I think the products that we are building, both in terms of detecting the disease, in terms of managing patients, in terms of remotely managing them at home, will be critical components to that flattening of the curve.
Definitely. Yeah, absolutely. You're right. I think one of the more critical aspects that, India at least is looking at is just currently managing this caseload of patients, especially depending on which city you're really, looking at. And in India, at least, we've had, we do currently have a very, very low number of radiologists. Official estimates say that we only have 10,000 radiologists in this country, and we're at least we're a billion strong as a population. So, this particular area, how do you really think AI, and specifically Qure AI, how do you think you can address this gap?
Sure. No, great point. And let me tell you, it's the reality for every country. So I mean, I remember when I grew up in India, my mom was a doctor, and when I was even in GE in India, I used to meet so many people in small towns where they would say, listen, I don't have access to the technology, I don't have a CT, and even if I have the money to buy a CT, I don't have anybody who will read it. I used to
Right.
see centers where X-rays were being read by whoever physician was owning that center. Now, whether that physician was a trained radiologist or not didn't matter. And honestly, you couldn't do anything because, as you said, there is such a missile shortage of radiologists
Yeah.
that there was no way you could get somebody to work in a small town. Every radiologist, once they finished their training, wanted to move to a bigger city where their earning potential or their quality of life was better. So the way I see AI playing that role is, in a way, bridging that gap. Imagine you're in a small town and you get hit in a road accident. You are absolutely certain you don't have a neuroradiologist who's trained to read brain scans there.
Yeah.
But you can very easily, with using today's technology, using telecommunication, using the cloud, immediately send that scan to a AI algorithm sitting in a server on the cloud, get an interpretation, and help that patient. So like this, there are so many examples of what I have seen even in our current deployments and some of the things we are working on, where I think AI can be a very critical piece, and in fact, so far the missing piece to improving the access of care in rural parts of India. where we've struggled with this for so long. Because,
Mm.
even when I was at G, I realized that just technology as a hardware alone doesn't solve the problem. What the patient needs, even if the technology is cheap. If I look at beyond radiology, ECGs are cheap, but how many
Right.
cardiologists exist to read accurately an ECG if it's done in a remote part of the country?
Yeah, exactly.
So I think AI, definitely for us, where like you mentioned, there is such a dire shortage of radiologists, but in every part of healthcare delivery will be a critical element to improving access and
Mm.
eventually also reducing the cost of care. You can do
Got
this
it.
repeatedly with higher accuracy at a much lower cost than
Mm.
getting a trained professional to do it.
Yeah, true. And it's not like we can upskill radiologists overnight. There is a certain amount of time it takes to actually get them to finish their degrees, go through medical school, get the requisite amount of training, and we can't wait that long. I mean, especially when we have a pandemic of this magnitude that's affecting the entire country, it's pretty much brought us all to a complete standstill.
Yeah.
These gaps have to be filled, and they have to be filled quickly. So AI really does seem to be the only hope at this point.
Yeah, no, absolutely. And I think, it's time that every country, I mean, India has been, struggling for so many years to meet their Millennium Development Goals. It's not
Yeah.
just, it's tuberculosis, it's all the infectious diseases, safe birth. While the government has been making good strides in terms
Hmm.
of improving health infrastructure, uh, the private sector has invested a lot, but it
Hmm.
still doesn't reach, the interiors of the country. And I think the only way to improve that access, the only way to improve that reach is to use technology like AI.
That's all the time we have today. Thank you so much for tuning in.